Now, there's one clinic in Omaha with customized medical weight loss and thyroid treatment, even hormone replacement therapy for both men and women. But at Omaha TRT Institute, testosterone, it's in the name, and that's what the first T stands for. Dr. Jeffrey Passer specializes in hormone replacement, and so does Dr. Daniel Gross over there, and Gabe Sullivan. Thanks for stopping by as well.
See you
guys. Dr. Gross, I want to start with you because you're kind of new to the clinic,
Yeah.
right? You're not new to Omaha. You grew up here, went away for medical school and some training, but what kind of experience do you bring to this team?
You know, it's just really a thrill to be able to work with Dr. Passer. I was able to do some research with the sports medicine department at Mass General, and being able to come back and work with somebody who has the experience and knowledge that Dr. Passer has is just a real privilege and exciting.
Yeah, we've talked to Dr. Passer, specializes in, there's a lot of different services that are kind of surrounding this, not only for men, but for women as well. Let's focus on who do you work with? Who do you help?
Well, men and women, obviously, because we have a nurse practitioner who specializes in women's health care also. But our goal is to help men and women as they age to restore and rebuild their systems so that they can enjoy their life as they get to middle age and prosper physically and mentally as they get older.
Yeah, and I think we've kind of entered a new era because it seems like people look at aging a little bit differently than maybe years past. It's not, you know, as you're getting older, you're not sitting on the porch with a glass of lemonade anymore. Right. We're more active. And to stay active, there's things that we can do. What type of services are we talking about here?
Well, we're talking about hormone replacement, lifestyle modification. A person can't expect to just go get a shot or a pill. Going to change their whole life. Yeah. It may replace something that's necessary and missing in their function, but the hormonal system of the body is like an orchestra, and if one instrument's out of tune, then yeah, you got to fix that, but then you got to look at everything else and your lifestyle, because I can tell you what to do, but if you don't do it, then you're not going to get anywhere, even if I give you a bunch of pills to take.
Yeah, and we've heard the term low T. Affects a lot of guys out there as they get in through the aging process. But what are some signs that a guy may have low T? And I don't know who wants to take this one, Dr. Passer?
Yeah, take it away.
Well, increasingly tired in the afternoon, lack of motivation, lack of interest in doing things. They've lost that competitive edge, is what I like to call it. Mm-hmm. And you can get a little bit fatter and tireder, and your libido goes down, and you just don't care.
Right, gives you more energy, right?
Energy.
Gabe, I want to talk to you a second, because there's different ways to go about this in terms of financially. I mean, I don't know if does insurance cover some of this, and then price is always a consideration, isn't it?
It is. It is. Insurance will cover the majority of it, depending on who your carrier is. But what you really need to look at in testosterone replacement is, one, you need to look at your provider, get the history of the clinic, get the history of the provider. Is this a chiropractor that's trained to do testosterone replacement, or is it an internal medicine doc like Dr. Passer has years experience with it?
Yeah.
And look at the price point. Look at the price point of the clinic, and I can tell you at Omaha TRT we are one of the lowest priced in the area. If you do not have insurance, you won't pay over $195 a month with Omaha TRT.
Well, fantastic. I think in healthcare, sometimes patients don't look at price. They don't compare doctors, and that's one of the things that they should really look at. And Dr. Gross, I know having doctors in-house, that's one of the things that Dr. Passer has talked about with us. Was that something that was important to you when you decided to come to the clinic?
Absolutely, and you know, again, just having the ability to work with somebody who has that knowledge and experience and doesn't just take care of one fraction of somebody's symptoms, but has the ability to look at somebody as a whole individual. And I really think that there's just a lot of effective therapies that Omaha TRT is able to provide that really act as a spark and a catalyst to people that are really willing to make meaningful changes in their lives.
Yeah, and kind of like we touched on, I feel like Dr. Gross, you'd be a good person to ask since you're fairly new to the clinic, but patients, you really encourage them to look around not only at the doctors at the clinic, but the clinic itself.
Indeed, indeed. There's a lot that's going on, as Dr. Passer said. It's it seems like a very straightforward intervention, but really there's a lot of moving parts and a lot of factors, and it's essential to have a very qualified team with you, and I feel like that's all in place.
Yeah, well, when you talk about moving parts, there's a whole realm of services And so that's why I'd encourage you to go to the website. JeffreyPasserMD.com is the website. And you can see on the left side there services. I mean, we're looking at what, 12, 13, 14, 15 services, not only for men, but for women as well. Are referrals necessary, or can patients call on their own? Do they need a referral, or how does that work?
No, don't need a referral. Jump on the website, listen to us on the radio, watch for us on TV, and then call in. We'll make it a consult. Free consult, always a free consult. We'll go over your symptoms, and then we'll bring you back in if doctor deems the treatment's necessary.
Yeah, fantastic, guys. Thanks for coming in.
Yeah,
JeffreyPasserMD.com is a website, or just give them a call. Omaha TRT Institute, 391-3800, guys. Dr. Gross, thanks for stopping in, and welcome to the new clinic. Jeffrey Passer,
Thanks.
good to see you as well. Gabe, thanks a lot.
You bet. Thanks,
Good to see
Mike.
you. All right.